Hey everyone, welcome to the Facebook Live Q&A for Online Pet Health Academy. I'm really excited today. We've got Natasha Lotter who's going to be chatting to us about one of her cases. She's based in Durban. For those of you that are not in South Africa, that's on the east coast of South Africa. And she has a clinic there called Animal Dynamics. And she also has her own products company called Holistic Pets. Welcome, Natasha.
Thank you so much, Megan, and thank you for the opportunity. Welcome to all of our listeners today.
Thanks, Joe. We're hoping for some people to come online. And when somebody is online, if you guys could just let us know whether you can hear us. So just give us some thumbs up, maybe some of those little hearts, so that we know that you're there and that you can hear us. Natasha, well, let's just chat a little bit before we start chatting about you, because I see that we don't have any viewers online now, and I want to get a few people on just to make sure. Let's just chat about where you come from. So in Durban, are there a lot of people doing what you do there?
In terms of, I think, South Africa, we're a little bit quieter. So there are a few of us, geographically spaced out as well, which is great. So obviously on the remote areas, but with technology as well, there's definitely the opportunity for travel. There's the opportunity for online wheels fitting, for example. We've done quite a few fitting of wheelchairs online. So with technology, the world's become so much smaller. I even look at this forum. People can just log on from wherever they are, whether they are in rural Natal or wherever. They can get onto their computer or their phone, and they can get really solid sound advice for helping their dog out. And it's fantastic. And it's always an example. We look at Cape Town and Joburg. Unfortunately, we don't have an underwater treadmill here, but you do in Joburg and Cape Town, and it's awesome to feed off a community, and the rehab community is growing, it's strong, it's supportive, and that allows us to in turn offer that to the clients. So it's very inspiring to be in this field. It's growing rapidly, and we're seeing great results for the pet owners and for the pets.
And I think your area will come on, there's growth everywhere. So yeah, give Durban a chance. I see we've got some people online. Guys, please give us some thumbs up and some hearts, so that we know that you can hear us. If we can see anyone there, yeah, we've got a few. That's awesome. So Natasha, do you want to start off by just telling us a little bit about yourself, how you got into the field, and sort of your path of where you are today?
Right, so I'm actually a marine biologist. It sounds quite crazy. I've always had the passion for animals. I was going to work with animals since I was yay high and starting school. And I finished school and went to the marine biology route and landed up working with marine mammals. And I definitely still have a strong passion for exotics. I will just about work on anything, reptiles included, although they are not my favorite. And so we had the awesome opportunity to move overseas in 2007. And this field, I definitely had more exposure to it being overseas. And I decided that's it. I need to be doing more. I was in the training field, so the behavioral field. And it was either going to be veterinary or veterinary rehab. And this is it. So I predominantly do dogs. I've got a keen interest in hydrotherapy senior dogs. I have a practice here in Durban North. I do also work on horses off-site, and as I mentioned, any exotics that come my way. So I'm open to anything and working on any creature, great or small.
Awesome. So, and today you're going to be chatting to us a little bit about one of your cases. And it's something that we often see here in older dogs, vestibular syndrome. And I'll leave you to chat more about it. But I'm sure there are a lot of pet owners that have been in this position. And it's great to be able to share what you can do, and just some tips and advice about how to manage an older dog that is suffering from this condition. As we've got a few more people online, that's awesome, guys. Please give us some thumbs and some hearts up. And if you have any questions while we're chatting, please just post them in the comment section, and either myself or Natasha will answer them during the Facebook Live. So Natasha, do you want to start off telling us about your case, the condition that it's suffering from, and just a little bit about you, his age, what type of dog, all that kind of thing.
All right, so my case today is Darty. Darty is a German Shepherd that I have had the pleasure and privilege of working with for 8 years now. So I have worked with her from before Vestibular right the way through this episode, and we are managing her and she's doing very well. So as I said, she is a German Shepherd, which straight away leads us to it's a large breed. It is a breed prone to hip issues, a lot of orthopedic issues, lumbosacral disease. We have treated her for this in the past, and in 2015, I lied. 2015 was one of her vet visits with a flare-up. In 2017, she had her first acute vestibular flare-up, or where she was admitted to the emergency vet. Vestibular we are seeing a lot more of, especially in senior dogs. A lot of the symptoms that we see in vestibular seem to be quite similar to that of a stroke. So we often have people saying to us, I think my dog has had a stroke, or they're definite stroke symptoms. And that straight away always raises the slight alarm bell that particularly, or perhaps we could be dealing with a vestibular case. So the symptoms would be loss of balance, stumbling, falling over, walking in circles, weakness, I'll get onto a little bit later. A head tilt is very common. They kind of look at you like this permanently, so it will be generally to one side, left or right. And then they experience what we call nystagmus, which is a flickering of the eyes. So when you look at them, their eyes will be moving continuously. So definitely for me, the nystagmus and the head tilt are quite characteristic. But falling, stumbling, walking in circles, loss of balance are your symptoms.
Yeah, so I mean, obviously, with a large breed dog, having a dog that can't balance, is falling over, there are a lot of challenges. A lot of challenges for the owner as well as the dogs. Let's chat a little bit about that. So, I mean, what with a dog that is stumbling and uncoordinated, what challenges would they have?
Well, obviously, to begin, before we have the stumbling, the owner's pretty much the first flare-up we had. The owner said that Darty was so incredibly weak, she couldn't get herself up. She had difficulty lifting her head. And being a dog that weighed 40 kilograms, it's not easy to be able to just pick her up and maneuver her about. So to begin, they were using a towel. A towel I don't always recommend, especially for large breed dogs, because often when we place a towel around their abdomen, we're applying support in the wrong area. So we're applying support through the abdomen and not through the pelvis. That can put further strain on the back, especially when we have a lumbosacral case who probably has changes, bone changes within the spine, but also we compress the abdominal organs. So you might get inappropriate urination or defecation, or just pressure on organs that we don't necessarily want to be placing. So for a dog of this size, we fitted Darty into a full body harness early days. It has handles over the shoulders and over the hips, and it meant that the owners also felt more confident and empowered to be able to stand her up regularly, to be able to take her outside to the toilet, and just to be able to maneuver her about in those first few days, which are quite critical. They to now still use that full body harness. And when we have flare-ups, which we have had one, they use the whole harness together because it is adjustable in that you can use the front, the back, or both. And generally now we are at the point that we have the front section, so we can kind of steer her and keep her upright when she has those wobbles. But the back section we've been able to take off and take away.
No, it's amazing actually that harness helps both the owner and the pet, because the pet actually, I've seen dogs, when they've got a harness and suddenly getting a little bit more confident because they know that their owner is there to catch them if they're going to fall.
Yes.
And just thinking about other cases of mine that I've treated, arthritic dogs that are maybe scared of going up and down stairs,
Yes.
amazingly, the dog won't do it. And then you just put the harness on and you're not holding them. But then they walk up and down the stairs because they just know that gives them a bit of security to know that if they fall, you're right there and you're going to catch them. So especially with a dog that is weak and unstable, this will help the dog too, just to know that you're there and you've got them. So
It's
let's
very
chat a little
Sorry?
bit about possibly the flaws in houses. So when I think of a dog that's got vestibular syndrome, that's one of the first things, because now in modern day houses, we have laminate floors, wooden floors, tile floors, which are wonderful for us, easy to clean, and maybe a little bit more sort of allergen free because we're not having carpets with all these dust and dust mites and things accumulating, but not so easy for our pets, especially as they get older and maybe arthritic, and especially with a German Shepherd that has got some neurological weakness. So, what recommendations did you make to the owners? What was their house like? Did they have stairs? Let's look at Darty's environment a little bit and what changes you had to make during the treatment for the vestibular syndrome.
Okay, so environmental modifications are always really important, as you mentioned, for any senior dog, whether it be an arthritic dog or certainly a case of vestibular. They fortunately are in a single-story house, so we didn't have to contend with stairs.
Good.
However, yes. However, the house was all slippery floors. So the owners, I love them to bits, and they're a very special couple. They don't have children, so dear Darty is their baby. So they went and recarpeted their entire house.
Wow.
That's pretty awesome.
Yeah.
A lot of other options. So the first one that I'm not sure if everyone's aware of is the rubber booties, the sticky paws. And we use them a lot, especially for neurological or weak arthritic cases. You can leave them on for extended periods and then take them off and let the booties and the dog's feet breathe. If you're a vestibular and you're arthritic and you've got slippery floors and already the world is maybe you've got vertigo, dizziness, nausea, there's probably nothing worse than slipping about. So that is a sticky paw, and this is a large, which would fit a German Shepherd. So people are often concerned about the size of the neck, that it's too tight. They do have a lot of stretch on there. So, I mean, to give you an idea, trying to stretch so that you can see, you can stretch to get them over the dog's feet. This isn't the only product available. There is paw friction, which has a slightly longer application, but they last for a few days. That is a topical application to the pads of the feet. Or there is Showfoot spray, which you can spray on. So there's a lot of options at the moment as to what to do without having to recarpet your whole house.
Yeah, so I mean, I think that's the main thing is I mean, they could even buy rugs, and I've seen people just use like yoga mats actually. And the important areas are like where your dog is getting up from a lying down position, so wherever they're sleeping. Because usually their first few steps are a lot more difficult for them. They don't have that control. And then just also where they're eating. You know, normally these kind of dogs, we need to raise their food bowls and actually even support them. And sometimes they even need to lie down. But if they get to the stage where they're actually able to stand, we want to make sure that they're not having to keep their feet from spraying out. Are there any other modifications that you had to make with the environment?
We raised the food bowl, so we did that straight away. The first episode, she was really weak. So they were hand feeding, which is often the case in those first few days in a really acute episode, is just getting the food and the nutrition into them. Nutrition's got quite an important part to play with keeping these vestibular patients managed. So they were feeding the dog lying down, but as soon as the dog was able to stand with support, we were getting her to stand up for short periods, eat, but with that food bowl raised up.
Yeah, they can also be often a bit nauseous. So, you know, like us, you know, when you're feeling a bit dizzy and stuff, and people that have got vestibular syndrome, one of their symptoms is nausea. So that is something to remember in these cases. Now, if we look at how these cases usually present, it's usually quite an acute onset, and there are sometimes we can find a cause for it, for vestibular syndrome. Other times we don't know what causes it, and then we just group it as something called idiopathic vestibular syndrome. And I must say, most of the cases that I see and I've treated, we haven't really found a cause, and we just put them into this idiopathic vestibular syndrome. But if it could be caused by a middle ear infection, then you would need to treat with antibiotics. But most of the time, it's really just supportive treatment, and we give anti-inflammatories. I think in your case, I think that they were giving a muscle relaxant, right?
Yeah.
Robaxin, yes, yeah. So like they're different things that we just support them basically. Sometimes they need to be on a drip for a few hours or for 2 days or so, depending on whether they're getting any liquid in or being able to eat. But usually they'll have sort of 24 to 48 hours of really severe symptoms, and then after 72 hours, in my experience, they start to improve. And within 7 to 10 days, we usually are able to get them to walk. And then usually after 3 weeks, they usually come right and they're actually able to ambulate. But this is obviously not in all cases. So, usually when we're looking at speaking to owners and how they are going to manage cases like this, it's usually, as we say to them, it's going to be 3 weeks or so. And then sometimes some of the symptoms can carry on. So how long has it been for Darty now? So how far are you in since you first started seeing the acute symptoms?
Darty was early 2017, and then she had, so flare-ups or setbacks can often occur, especially when we don't always know the roots. So for example, if cancer or neoplasia or an infection is a cause, you can possibly have flare-ups. And we've had one flare-up. It definitely was not as severe as the first, but we haven't had any flare-ups in 8-9 months. So fingers crossed.
And is she able to walk normally now, or does she still have some symptoms?
She still has a marginal head tilt. Often that head tilt doesn't go away. So while their balance can improve and the flickering of the eyes improves, I do think she's definitely still has nausea days. But we have changed her food, and she is coping a lot better on her new food. And I think the owners have seen a big difference. Weight has always been a big concern, being a large breed with the arthritic joints. But we might have had a kilogram increase in weight, but definitely Darty's coping well. Skin and coat, movements, awareness of her environment. She's doing pretty well.
Let's chat a little bit about what you do for her from the veterinary physiotherapy or rehabilitation level. So obviously a dog that is walking around with the head tilt, there's going to be a lot of secondary compensatory muscle pain and discomfort. And I suppose that's continual for you now, having to manage that.
Definitely. So muscle tone, relieving muscle tension and spasm. We do use a lot of acupressure, red light, massage. She isn't a big fan of the pulse electromagnetic field therapy. That's the one object. Yeah, she really. She's a dog that has definitely shown more signs of aggression through this period. And as she's got older, and I think stress has played a large factor or a large role in that. She has periods where you can see she gets quite anxious. So it's been interesting to manage and see what she will tolerate and what she won't.
So I'm interested in her. So is that, when you're using the pulse electromagnetic field therapy, what makes you think that she doesn't tolerate it? Is that when the aggression starts, or?
Yeah, wow. Definitely. It's the one thing. The red light, we've been able to, with treats, a lot of treats, healthy ones, but PEMF, absolutely no. Literally, as you're with the loop, even the beamer, you apply it straight away. She's anxious, she objects, and then you get your aggression quickly. Yeah. So it's been interesting.
So it's been challenging from a therapist point of view, because often when we have those cases that are aggressive, there's so much that you can do, and we're limited because we don't want to ever treat a patient where we're having to to hold them down or anything like that. Then there's not really much point in that, because we're just going to cause more injury or more muscle tension. So when we're treating our patients, we need them to be as relaxed as possible. And sometimes in these aggressive dogs, and I must say, usually when I have really aggressive dogs, that's the first thing that I do is put them on the pulse selection and field therapy mat. So especially those ones that I can't touch. And I can recall having a few cases that have had cruciate ruptures, and they've been operated on, and maybe 2 or 3 weeks post-operatively are non-weight bearing at all. So they've come to me, and I literally have not been able to be able to touch the dog in the first treatment. And for those pet owners, we often do have cases like this, but over time, the dog actually begins to trust us, and they realize actually we're not going to hurt them. And usually maybe after 3 or 4 treatments, we're maybe able to do something, and in some cases we're not. But I can remember this particular case where this dog had not been putting its toe down. It was non-weight bearing, and this is the time that I really knew that it was the pulse electromagnetic field therapy, because I put the dog on for 20 minutes, and the next day the owner phoned me and said, "You're amazing, my dog was walking." And I didn't touch it, the dog, so it was nothing I did, So it is challenging, definitely. And now tell me, Natasha, do you see a lot of these cases?
We see a fair amount of these cases that have been diagnosed, and we see a fair amount where I'm definitely suspicious, especially with often the owners will come to describe a history of events, and definitely immediately my mind goes to vestibular.
And often, especially with a lot of these cases, we're always in a toss-up as a vet, what to do. So do we spend the money on doing diagnostics?
Yeah.
So doing MRIs to try and get a diagnosis? Or do we spend the money on just potentially doing rehab and trying to just get them better? Because often, if the condition is not surgical, the treatment is the same. So, which often makes our job as a veterinary rehabilitation therapist tricky, because we're treating a condition which we just think that it might be that, but we're not sure.
Yes.
So it's so much easier to treat when we have an actually definitive diagnosis. This is what it is, because then we know what to do, how to treat it. And then when we're treating it and we're not too sure because we haven't had the MRI and things are not working, then we're guessing, we're thinking, well, maybe it's something else. So it makes it a lot more tricky for us. But we just, I think the thing is you just treat what you see. And every single time you see one of these patients, sometimes there's something new that has sprung up in them. But they're challenging.
They are, but it's worthwhile. For me, the biggest breakthrough was changing her food. Definitely changing her food. The reason we did change was, German Shepherd, her coat literally went extremely pale and was coming out in plugs. And that is what sparked us to actually go, you know what, we need to change her food. We need to do something about this. The owners noticed the difference in about 10 to 14 days. And between 2 to 4 weeks, they actually said to me, it was like they had reverse time and they had their old Darty back. She now chases the postman. She goes to the door when the doorbell rings. And it was like they had rewound time. And that was quite special for them. And it can be quite stressful for us the older your dog gets. Maybe sometimes your days are numbered. And when you can rewind time and see your spring chicken back, that can be something really quite special for an owner.
Yeah, and rewarding for you. To see it like that.
Definitely.
So if you have any questions, please post them in the comment section. If you are watching this as a recording, please, you can post the comments and either Natasha or myself will come afterwards and answer your questions. So if you have a dog that is suffering at the moment from vestibular syndrome or has previously, and you're wondering what you can do to help, if there's anything, please just put a little question in the comments and we'll do our best to answer. So Natasha, have you got a busy day? Have you got lots of patients still to treat? I know I've taken you away during your lunch break.
We've got a busy afternoon ahead, yes. We have a question.
Lots of thank yous and clapping of hands. So thanks, guys. Natasha, thank you so much. It's so interesting. We were chatting earlier, and Natasha was saying that she thinks that she should have chatted about another case. And I said to her, "Don't worry, there's another time. So we'll get Natasha back online
Thank you.
to chat about other cases. And these Facebook Lives are here for you guys, for the pet owners. We really just want to share with you things that we can do to help your pets. So please just put a comment in there and we will do our best to answer them. Oh, I see somebody actually did ask. They said, what type of diet did they put the dog on?
Okay, so we changed over. The owners have always been quite fond of the Heels range. So the dog was on metabolic before Metabolic Plus Mobility was on the market. When that food came on the market, they changed to that food. And over the last few months, we have gone on to Youthful Vitality. So Darty is no longer on a prescription diet, but we have seen magnificent results on this new food that's in the range.
Awesome. Sorry about that. I had to go just now. My little Jack Russell. I'm going to show it to you. This is little Sushi, everyone.
Hello,
Sushi is
Sushi.
she's 13 years old now. My little Sushi. She's a little rescue. She's
Awesome.
barking at the door. All right, everyone. Have an awesome day. Thanks so much, Natasha. And we'll see you guys next month for the next Q&A session. Have an awesome day. Bye.